Please stand by for important information from the leader of the City of Boston, Mayor Martin J. Walsh. Please stand by for important information from the leader of the City of Boston, Mayor Martin J. Walsh. Please stand by for important information from the leader of the City of Boston, Mayor Martin J. Walsh. Please stand by for important information from the leader of the City of Boston, Mayor Martin J. Walsh. Please stand by for important information from the leader of the City of Boston, Mayor Martin J. Walsh. Please stand by for important information from the leader of the City of Boston, Mayor Martin J. Walsh. Please stand by for important information from the leader of the City of Boston, Mayor Martin J. Walsh. Please stand by for important information from the leader of the City of Boston, Mayor Martin J. Walsh.
Thank you, everyone, for being here today. The state numbers, an update as of yesterday. Massachusetts of positive cases statewide, 79,332. That's an increase of 870 over Monday. And the state now has reported 5,141 deaths. That was up 33 as of Monday. Boston numbers as of yesterday, 11,168 cases. That's an increase of 62 cases from the previous day. And 533 people have passed away. That's the same number as Monday. A day with no deaths to report is certainly a good day, but we still have work to do. If we want to see that every day, we need to continue to do that. And I'd like to just continue to keep the families of those who lost loved ones in our prayers, and the folks that are getting in the hospital or at Spalding getting better. I want to say we're praying for you as well, or other rehabilitations around the Commonwealth. We also now have confirmed 3,805 recoveries. That number is going up faster as we begin to get data from the state's community tracing collaborative. Boston Hope Medical Center is currently serving 158 individuals, 83 on the shelter side, 75 on the hospital side. Altogether, since Boston Hope was built, 688 COVID patients have been treated at the convention center. Today I'm going to give some updates on the work of the Boston Resiliency Fund supporting in our communities, the work to provide relief to small businesses hurt by this crisis, and a resource we are making available to help people secure their federal stimulus payments. First, I want to say a word on the reopening and recovery plans. As of Monday, Monday, May 18th approaches, it's a date that a lot of people are focusing on, because when the Governor's Advisory Board is due to release a report as well, so people are paying deep attention to that date. We are working every day as part of that board We support a cautious, phased-in approach that includes clear health criteria and safety guidelines for each industry. Our administrative team is working on what that will look like here at City Hall for city employees and throughout the city of Boston. And we're also in conversations with employers in Boston in many industries, such as restaurants, as well as labor organizations, faith communities, advocacy organizations, healthcare providers, colleges, universities, office buildings, and many different other organizations and businesses in our city. We have worked to make this broad and inclusive conversation with the focus on equity and the impacts that different communities are certainly experiencing, both in health impacts and economic impacts. But I want to temper expectations of what Monday will bring. We don't move forward based on the date, we move forward based on data. This must be a gradual phase-in approach that depends on testing and hospital metrics reaching certain benchmarks and continuing to move in the right direction. I want to warn people, if we open too soon or we let down our guard, we could get spikes in cases faster. Then we would have to roll back all of the work that we're doing now and opening and essentially starting over. That would be worse for our economy, and that would be terrible for all the individuals here in Boston and in the Commonwealth. Remember, it's not public health versus the economy. They can only move forward together. So we need to move cautiously. All of us have to stay focused on what got us this far: physical distancing, covering faces with face masks, washing hands with soap and warm water, cleaning and disinfecting our surfaces. We should continue to limit our trips outside of the home to only for the essentials, and to avoid crowded conditions of any kind. I want to be clear about the principles that guide us. We base our decisions on science-based facts. We prioritize the health and security of all the residents of Boston and visitors. And we will keep working to meet the needs of families, seniors, frontline workers, and everyone in our city who's impacted in this crisis. That's the work we are advancing with the Boston Resiliency Fund. As of yesterday, we raised $30.7 million from over 5,800 donations. The purpose of the fund is to provide food for children and seniors, technology for students, support the frontline workers. The fund is informed by our COVID-19 Health Inequities Task Force, so we can get the resources into the communities that has the deepest needs. We use it to expand COVID testing and outreach in our hardest hit communities and in every neighborhood across the city of Boston. This week, we're distributing $1.3 million to 17 different organizations. 52% of those organizations are led by persons of color and 47% by women. These grants will allow us to expand the telehealth COVID-19 treatment from 9 current sites to 19 community health centers across the city. That's important because it connects testing to care. We don't want people testing positive and then being left on their own to figure out what the next steps are. We want to make sure resources are available at the point of testing. Additional grant support to community organizations in providing food, child care, gift cards, face coverings, and more for folks and families in need. The populations they work with include seniors, service workers, young people of color, and homeless individuals. One grant that we're proud of, one of the grants we're most proud of, is the Schwartz Center for Compassion Healthcare, to provide emotional and psychological support to healthcare workers. The program they are launching draws on PTSD experts who work with veterans. They will train staff at hospitals and health centers to treat job-related stress at the work site. So it's important, given with many of our frontline healthcare workers and what they're dealing with right now, that we only offer them the support that they need. Now, we have another great example of neighbors helping neighbors. We're supporting the Newmarket Business Association, who will provide trucks for delivery support to their neighbors at the Greater Boston Food Bank. That grant will create needed jobs and help us get more food to families and seniors across the city and, quite honestly, the region. I can also announce that based on our previous grants, COVID testing is underway at the South Boston Community Health Center and in Charlestown, the Charlestown location of the North End Waterfront Health Center. With this week's grants, we will have now distributed $17.5 million to over 200 organizations who are doing vital work to support Boston's neighborhoods and communities. A brief update on our Small Business Relief Fund. I've said it many times, small businesses, they're at the heartbeat of our economy. Local restaurants, the corner stores, child care providers, flower shops, cleaners, and many more. Neighborhoods simply just don't work without having these stores and businesses. Many of them have been hurt badly during this crisis. So we made their needs a priority in a number of ways, including direct financial support through our Small Business Relief Fund. I announced last week that the first $2 million of relief is in the hands of 561 local-owned businesses in the industries that have been hit the hardest by this crisis. We have added an additional $5.5 million more to help eligible businesses that have applied. We did this work with the urgency it requires and with the fiscal responsibility that Boston taxpayers deserve, including all of our small businesses. And also, we did it with equity. I want to paint a picture of who this relief is helping in both numbers and names. This is nothing like the stories we have heard about issues with the federal program. In our city of Boston, 58% of the businesses receiving the grants are owned by people of color. 48% are owned by women, 44% owned by immigrants, 95% of the businesses have 15 or fewer employees. The top 10 zip codes with the most recipients include East Boston, Jamaica Plain, Brighton, South End, Dorchester, Rosendale, and Roxbury. The full list of recipients is posted online at boston.gov. They're a true cross-section of small businesses in our city. They include people like Margarita Corrado and her son Andres, who run a Mexican food business in Eggleston Square, Rosendale, and the South End. Christine Rose and her team at the Four Corners Yoga and Wellness Studio in Dorchester. Y. Kin Chan, who owns Ken's Hair and Beauty Salon in Chinatown. And Ramon Zapata, who owns Albert Style Barbershop in Dorchester. We received feedback that these grants were used to cover everything from rent payments, to utilities, to vehicle payments and insurance, and to employees' wages. More than one owner told us that these payments kept them from having to close their doors permanently. One of the reasons we're able to do this work is with both equity and urgency in our small business team is because we have a diverse, multilingual, on-the-ground team that is engaged with grassroots small businesses in every neighborhood and ethnic community in the city of Boston. They're doing this work, staying in contact with business owners and listening to their needs. I've talked from this podium many times about doing different types of surveys. The surveys that we're receiving, we're helping create those programs off the surveys, hearing directly from our businesses. And we're proud to have more than tripled the size of the fund since the first round of applicants. And as I said in the beginning, we know that this is not the end-all. We cannot help every single business in the city of Boston. That's why it's important for us to have our partners in the federal government and the state government also to continue to create opportunities for small businesses. We want to make sure that Bostonians have equitable access to benefits from federal and state sources. For example, we learned that our low-income residents are having difficulty getting the $1,200 federal stimulus check payment they're eligible for. If you don't file tax returns, you have to apply for the money separately, and the process can be very confusing. So we set up a stimulus hotline. The number is 781-399-5330, or you can call 311 to get connected, or visit bostontaxhelp.org. It's staffed by our Boston Tax Help Coalition. It's a partnership of nonprofits, businesses, and community organizations that provides free tax services every single spring. It's the largest program in our Office of Financial Empowerment. While state and federal tax lines is extended to July 15th, we are pivoting to provide help right now on stimulus checks. We want every Boston resident who is eligible to receive this money, we want you to receive it. It will help them out, and it will also be a shot in the arm for our local economy. The Tax Help Coalition is getting ready to provide its usual free service for July 15 tax deadline for those who make under $56,000 a year. We are setting up technology to be able to provide these services virtually in the coming weeks. I want to close by a reminder about public access to City Hall with city departments. Many of the services you may need now are available online at boston.gov. You can also call 311 for guidance. The building remains open to the public only on Tuesdays and Fridays. You must make an appointment ahead of time for in-person services. When you arrive, you'll be asked about COVID symptoms and given a temperature check before entering the building. Those steps are required for every single city employee who comes in the building as well. Residents of Boston can still register to vote, get their resident parking permit, or pay their parking tickets or their taxes. Yesterday, as an example, 123 members of the public visited City Hall for appointments. Sadly, we've seen an uptick in death certificates due to the pandemic. But at the same time, we're also issuing plenty of birth certificates and marriage certificates. Life in our city is still thriving in many ways, and we are blessed in City Hall to be part of that. It's taken careful planning to keep these services available and keep both the public and city workers as safe as possible. I want to thank everyone involved in this work. I especially want to give a shout out today to our Municipal Protective Service officers. Many are on the plaza here with me or inside. We rely on them for safety and security at City Hall as other municipal properties. For many visitors, they are the face of government. They're the first to help you find what you need. They are welcoming, diverse, and professional, and they represent our city proudly. In this pandemic, they have not wavered one bit. They've been on duty 24 hours a day, and they've adapted to new conditions and new duties admirably. City Hall has not stopped serving the public, and they make all of our work possible. They are truly our unsung heroes, and I want to thank them all today for their incredible work. Now I'll open up to questions.
Mayor, with the weather getting better over the next couple of days, summer approaching, are you worried about people congregating at Carson Beach or Castle Island?
Yeah, I'm worried about groupings. I think that we're going to see people out and walking the beach and walking Castle Island and walking Savin Hill Beach and watching the Arboretum in different parts of the city of Boston. But we want to make sure that we're asking you not to stop and congregate. Because if you're walking with somebody and you stop and two to stop, talk to four, and all of a sudden now there's 10 people they're talking, that's where the fear of the spread of the virus is. If you see somebody out, give them a wave. How you doing? Wear your mask. Something that's really important. Wear your mask while you're out walking. If no one's around you, you happen to see no one around you, want to pull the mask down a bit, that's fine. But when you come up on people, we're asking you to put masks up. You know, we've had sporadic nice days here for the last 3 weeks, but it looks like we're heading into, today's supposed to be warmer than this, we're heading into some warmer days here, so we're going to ask people, please, be disciplined. We heard today, the numbers in the last 3 days in the city of positive cases have been in the double digits, 90, 67, I think, and then 52. They've been going down. There's two reasons for that. One is that the tests that we've taken are a little down. We haven't taken as many tests. But also the physical social distancing is working. There's no question about it. What we don't want to see to prevent the spike, even when we start to go back to work, we're going to have to do more of that physical distancing, because that will create, if we don't do that, that's where the spike will come. So the answer is, I should have repeated the question, I apologize. The question was, am I worried about the good weather coming and people congregating? So the short answer to the long answer is I'm concerned about it. But I think people understand at this point. Well, we announced it on Monday that we were going to do a lot of this stuff. We're looking at it. I don't want to start picking which ones we're going to do, because there's a little bit of a process that has to happen. The question was, the council held a hearing last night off of something I spoke about on Monday with opening up streets and dedicated bike lanes and more bus lanes and places for maybe not takeout, but sit-down dining outside in different areas of the city of Boston. And we're gonna be going. My office of transportation and streets are going through it right now. They're going to be working with the council and working with other elected officials and working with the community, quite honestly, because it's going to be a change. You know, I'm asking people not to say no off the bat. Generally, sometimes people, we automatically know, we have to get to yes. In this particular case, if we do something like that, we're doing it to either move transportation, move traffic along when people start to come back to work, and or allow our small businesses to get some opportunities to be able to, expand outside their four corners. So I'm excited about doing some of this stuff. We looked around the country. Seattle is doing some of this successfully. England is doing some of this successfully over in Europe. We're looking at what's happening in Italy and different places. So we're going to share and take some best practices if we can make it happen here. The timeline, the question is on the timeline, could some of them be in place by next week, reopening? I don't anticipate restaurants necessarily potentially be open next week. I think that, I don't know if we'll be ready for next week, but I think we have to start thinking it'll be fast-tracked. And one of the things that I'm recognizing here is that in the past, like the Small Business Fund, you know, we set that up about a month ago. We were able to turn the grant process around and get the checks out the door faster than under the normal circumstances. Sometimes it seems like a lifetime because this COVID week to week is dragging on. I think people are losing track of time and day and what day it is. But I think we're going to move pretty quickly on it. Any other questions?
How is tracking COVID cases breakdown by race at this point? Can you give us an update on
Oh, I don't have the exact numbers. I have the numbers. I think if I'm correct, I think I don't even fake them. We have the numbers. If you go online, we'll get them to you. But if people go online on the City of Boston website, we have all the racial breakdowns of who's tracking. I can tell you this: percentage-wise, the African American Black community is leading in percentage-wise as far as COVID cases. I want to say it's in the 38% tile, followed by white, Latino, Asian, I think, and then other, and then on the death side, it's white, African American, Black, Asian, I believe, and Latino. So I'll have to get the number for you on that. I'll make sure I have it when I do this again. But yeah, no, I had it this morning. I talked on the City Council about it, but it's on. Everything's online. Everything we have is online. And then also, I don't think we have yet the amount of tests we're doing per location online per day, but we're trying to get that information. And we're also going to have the information for deaths in nursing homes and assisted living facilities once a week, which next month, I presented it last Monday. I'll present it next Monday. So we're trying to get this data. I'd like to get it instantaneously if we can, but some of it we have to collect the data. We have hospital tests going on, the hospitals and DPH doing stuff, health centers. So it takes a little bit to get the information, all the data in time. There's not one dumping place to put all in.
No new deaths to report in the city. Is that the first time?
Since March, yeah, since early March. Yeah, it was, yeah, as of, we didn't get the numbers today yet. This was as of yesterday, which would have meant on today's Wednesday, Tuesday, Monday. No deaths on Monday. Not yet. I mean, we're trying to see, like, even like the last 3 days, we've seen numbers drop, and I've been trying to ask somebody, does that tell me anything? And the information is not completely accurate yet. We're trying to look at that to see. I mean, definitely we're seeing a gradual decrease, and we're seeing some positive news out of our hospitals of a decrease in emergency rooms for COVID as well. So that's all good signs. But again, you know, we're pretty much all shut down right now. My concern is as we watch this decrease, if we open up, we see a little bit of a spike. So what I'll do in the next, maybe the next press conference, I'll ask Marty Martinez, he couldn't be here today, to give you a little overview on some of the data that we're looking at, give you a better understanding of it. Not you, but the public, an understanding of it. Any other questions? Yeah, it is. I forgot my old mask, so I was given this, I think the L Street Running Club. No, L Street Bathhouse. Folks at L Street Bathhouse gave it to me, so it's a perfect match for Memorial Day.
There's not going to be a lot of summer programs for kids this year. You know, parents back at work, daycares may not be open. This is going to be a really weird and difficult summer for parents and for kids. Has the city started planning to accommodate that, or is that all possible?
So the question is on summer camps and kind of a different type of summer for kids and parents with no daycare until the June 28th, I think it is, or 29th, 7th. We're investigating right now to see if we can salvage any summer programming for our camp program in Boston. And then we also have like Camp Harborview on Long Island that does a camp every year. 900 kids go to that. The Ron Burton Training Village, which takes a lot of kids from the city of Boston out to the suburban towns to have a camp. We have our own camp that we run in our own city parks and community centers. So we're working on a task force right now, not a task force, not an organized task force, but working with a group with the state to find out exactly what we could do, making recommendations. Is there a chance we can have some type of summer programming? I think it's really important for our kids that we have some summer programming. programming. Again, it goes back to data and seeing what those numbers are at that point. We also have New York City, I believe, canceled their summer job program. We employ roughly 11,000, when I say we, collectively with the businesses, employ about 11,000 summer jobs for kids in the city of Boston. I'm committed to having that program move forward. It might not be as high as 11,000, and we might not have it in some private settings, but my commitment is to make sure that we have a summer job program for our kids. Many of our kids that work in the summer, they provide extra money for their families. They put food on the table. They're saving for college, and they're going to college. So we are going to have some sort of summer program here in the city. We're identifying where the gaps are. Not quite sure what they're going to do yet, the kids, but we are going to be doing some stuff. Maybe actually for the stations, if any ideas, if you could bring them back, if your newsrooms or stuff could use some summer kids helping out, if you have an opportunity, I would love for you to let me know. We're trying to find some good opportunities for kids. Anything else? All right, everybody, thanks. Have a great day. Thank you. Thanks, Karen.